If you're on hormone replacement therapy, I need your help. The FDA right now is opening the floor for comments on your experience with hormone replacement therapy. Finally, after 23 years, they are re-looking at the black box warning about hormone replacement therapy. In November of 2002, the FDA started with their warning on hormone replacement therapy due to a not very well done study called the Women's Health Initiative. The study was well done. The conclusions were not supported by the study, and yet they made the evening news and women all over the country got off their hormones. So what exactly is a black box warning? It's a white piece of paper, but it has a black outline, and it just says in big letters, warning, this can increase your risk of cancer. And it lists the different types of cancer and heart disease. Of course, if you're going to prescribe somebody for something that you think has all these risks, nobody wants to cause harm to their patients. So that created an issue with acceptance. But now they're finally realizing that maybe it didn't have the same risks that they thought it did. Maybe it actually has benefits. And for 23 years, women have been afraid of hormones because they were concerned that it causes breast cancer or heart attack, and that it certainly didn't decrease the risk of cardiovascular disease. Well, it does decrease the risk of cardiovascular disease if you start it within 10 years of being in menopause. Finally, they are re-looking at this issue. They had a panel of doctors in July discussing hormone replacement therapy, and most of them were very pro hormone replacement therapy, looking at the inappropriate severe warning that is on the package inserts for hormone replacement therapy. By the time this video is available, it's going to be 1 week. If you want to do this, please do it soon. Follow the link below. Leave your comments. Let your voice be heard. For most women, they sleep better. Their bones are stronger. Their moods are more stable. Their weight is more stable. They decrease risk of insulin resistance and diabetes, decreased risk of osteoporosis, colon cancer. The main thing is it protects your brain. That's the biggest benefit. Much lower incidence of Alzheimer's disease in women who take hormone replacement therapy. So we need to get the news out there that this is not harmful, that it is helpful, and that it's time to reverse 23 years of inaccurate information. I'm a traditionally trained OBGYN, and I was a U.S. Air Force doctor for 8 years. I knew the studies. I learned the studies. I could quote the studies, and I was brand new out of residency within a couple years when the Women's Health Initiative came out. Then we started looking at the data going, maybe this isn't what it says. They didn't do the conclusions right. They lumped women together who were 50 to 75 years old. There's a huge difference in cardiovascular risk with those age ranges. And so they can't use the study to say if it's preventing heart disease. If you are 70, you might already have heart disease. And they didn't do anything to prove that you didn't have heart disease before they enrolled you in the study. They just assumed, since you didn't have a diagnosis, that you were disease-free. Well, how many of those women might have had right up into where the symptoms start of heart disease, and then they started hormone replacement therapy, and during the trial, heart disease showed up? That was not a good part of the study. Another part of the study that wasn't good, they did not use bioidentical hormones. Bioidentical means it has the exact same shape molecularly that your ovaries used to make. That is important because hormones work like a key and a lock. If you have a different shaped key, it might open one door, but it might also open another door, and we don't want the doors open to heart disease, breast cancer. We want the doors open to healthy bones, healthy brain, healthy liver. We want those doors opened. With the non-bioidentical hormones that they used, there were other risks, and studies came out afterwards that showed that the bioidentical hormones did not have the same risk. Specifically with medroxyprogesterone acetate was the form of progesterone that was used in the study. This breast cancer cancer concern from hormones came out after and showed that, wow, women who were on estrogen alone did not have the risk of breast cancer. It was only those who were on the estrogen plus the medroxyprogesterone acetate. So maybe it wasn't the estrogen that increased the risk of cancer. Maybe it was the fake progesterone. The estrogen that was used in the study was oral, number one problem, because it increases inflammatory markers as it's metabolized by the liver because of digestion. So this has turned into a little bit of a rant on the Women's Health Initiative. That was not my intention when I started this, but really, truly, let's reach out. Let's make our voices known. Follow the link, leave your comments. And if you take it a step further, the way we practice hormone replacement therapy at Vitality Renewal, we believe that we use the safest method possible. Use the right hormones, check the levels, make sure they're balanced, monitor the urine to make sure that you metabolize the hormones in a safe fashion, because those are the three components of hormone replacement therapy done right. And then lastly, make sure you have receptors that work. Hormones only work when they can attach to their receptor, like a key and a lock. So if you have rusty locks, you can have keys, but the doors don't open. So you need the whole picture in order to do hormone replacement therapy right. But let's start with making sure that the hormones stay available and that we quit using scare tactics with outdated data. Reach out, make your comments, be heard.